So we're asking colleagues who have not yet signed. We are about 200 in this room, and just about 135 have signed. We're asking that you please go onto the link and sign that commitment. It's important to ensure that we hold a safe space for all. Thank you so much. So, colleagues, again, can we please grab our seats so that we start? Good morning, colleagues, and esteemed guests, partners, and of course, the vibrant young people in the room. You are welcome to the Men Engage Africa Section of Productive Health and Rights Symposium, the second edition. Welcome. Let me extend my greetings to those who are visiting Kenya for the first time. We know that this is a country of athletes. So if you find yourself lost, please don't worry. We would run that race with you. We are here together, and we would succeed. So thank you and welcome very much to everyone who has joined us today. As a convener for this symposium, I'm more than honored to welcome you all to this crucial gathering on advancing sexual and reproductive health and rights across the continent. We've organized this symposium with a clear purpose in mind. One is to foster collaboration, to share learning, because we all implement. Sometimes it's important for us to come together to share learning, and to also discuss what are the ways forward in terms of actions that we need to take as a collective towards advancing sexual and reproductive health and rights. Of course, the symposium is organized with the team promoting the realization of sexual and reproductive health and rights and gender equality across Africa. We call it Progress 2024. So welcome to Progress 2024. And for us, it reflects an urgent need for the pressing issues that continues to hinder the progress that we've seen in achieving sexual and reproductive health and rights across the continent. In our work in promoting sexual and reproductive health and rights, we believe that coordination is important. By coming together, gathering the evidence that we all have learned from each other, and exchanging experiences, we can strengthen that collaboration and our efforts. It's also an opportunity to identify gaps and look at how can we co-create impactful programs that would advance sexual and reproductive health and rights across the continent. We also have seen that policy is changing, and it's changing very fast, and we need to act. If we don't act, all of the progress that has been made, we would be going back on those progress, and this is not the time. The stakes are very high, in particular as we commemorate the 30th anniversary of the ICPD, and next year we will be commemorating the 30th anniversary of the Maputo Protocol. Now is the time to amplify our voices. Now is not the time to say we've achieved so much, let's take a back seat. No, we need to move forward. So this is why Progress 2024 is very important. These milestones that we have made remind us that challenges continue to persist, and there's the urgent need to accelerate efforts towards achieving the SRH and gender equality for all. It is a time for us to reflect, to recommit, and to plan strategically in terms of how do we do things differently. We all know there is that conversation that there's the anti-rights movement, the anti-gender movement, which is growing, right? Is there anyone in this room who would say that in my country there's no anti-rights or anti-gender movement? And it is coordinated. It is resourced. That is why we need our collective convening, so that we can coordinate amongst ourselves, we can put the resources we have together, and we can push back on the anti-rights movement. And so this is why this is important. This symposium, one of the things that we've organized it with a clear vision in mind is to ensure that we have young people in the room. And we've organized at a time when we've just celebrated International Youth Day. So happy International Youth Day to all the young people in this room. But why is this something we are celebrating? This is something we're celebrating because we've created a platform for young people to not sit in one spot and have conversations, but we've brought together our religious leaders, our traditional leaders, because we think it's important for us to have honest conversations. We know that like I said, the anti-rights movement is there. So we need to have honest conversation, not just young people in their corner, but with religious and traditional leaders who are stakeholders in this movement. And so the young people are at the heart of, of this movement. We appreciate your commitment, and we appreciate the work that you do and the value that you add. And we at Sonke and at Engage Africa, and to the many partners who have joined us in organizing this, youth leadership is something that we take pride in. Something we've added to this symposium is the feminist discourse. Because most times we feel that feminist discourse, we work in the SRHR field, but the feminist discourse is not part of that movement, right? We've also brought together HIV. We also sometimes assume, or we think that we can succeed on HIV alone without looking at SRHR. That is what we're changing here, to say we all belong to one movement. And for us to make progress, we need to come together as that one movement. So thank you to all the partners who agreed and contributed to making that the different voices are present in this room. Now let's talk about our program. It's packed. Lots of exciting things planned. Different rooms, and our hope is that new ideas will come out and that will push the boundaries of what we can achieve together. And so over the next few days, we will look forward to panels, workshops, site plenaries that will focus on key issues, including male engagement in SRHR, comprehensive sexuality education, youth-friendly service, and many other issues, including sports and SRHR, which is not something that we hear often, but we have key partners in the room who have joined to say we can integrate SRHR into sports. So we thank you for belonging, for coming. Something that we're proud of for this symposium is that we would be hosting a consultation to feed into the African Union Convention on Ending Violence Against Women and Girls. It's long overdue. And now that it's happening, we want our voices to be integrated in that conversation. And so it provides an opportunity for us to contribute our expertise, experiences, and recommendations to shape that instrument, which we hope will guide efforts towards ending gender-based violence across the continent. Unfortunately, so let me apologize upfront to say, we would not have everyone present. A few people will be invited. Please do not feel that your voices is not considered. We're trying to ensure that everyone's voice is present in that. Okay, and colleagues, at this point, I can only say thank you so much to all the partners and sponsors who have come to this event, and we hope that over the course of the next few days, you would enjoy the conversations and you would leave here more energized. Karibu. So at this point, we would do our opening ceremony. I will invite a few of the speakers to please take the floor and give us their comments. Can I please ask Maximina Jokoya?
Thank you so much, Jude. Good morning, everyone. Good morning, everyone. When you start with a young person, you know that the symposium is started. Good morning, everyone. There we go. There we go. Thank you so much for the opportunity. As highlighted, my name is Maximina Jokonya. I'm the Executive Director for Y Plus Global. And thank you to Men Engage for inviting me. I think this is my second symposium, so I'm really excited to be here. I think Jude has highlighted some of the critical issues that we need to consider for this symposium. And I'm really glad to be here because this is a great platform where we all not only learn from each other, but also co-create and share the agency that SRHR and gender actually is calling for right now. Sexual and reproductive health and rights are fundamental human rights, essential for the well-being and empowerment while we are practicing our reproductive justice, particularly us as young people. Despite the progress that has been made, and we've even read different reports that have been published, UNAIDS, the other big AIDS strategies that have been published, we are seeing and we are still facing different barriers as young people, especially the human rights that we should be practicing and expressing freely as young people, how we identify ourselves and whom we choose to love, and how we constantly be judged because of our statuses. We are all here for a collective change. A collective change that will give us an opportunity to be where we want to be. Our goal is very simple for the next 3 days, very, very simple. We are all experts in this room. So what we need to ask ourselves is, what are the experiences that we are bringing to the table, the knowledge, the strategies that needs us to get to that last mile where we want to be? What critical elements do we need to be really considering in our radar, especially in light of the human rights violations, the civic shrinking spaces, and lack of sustainable SRHR financing? Last week I was in an SRHR consultation that was looking at sustainable financing for sexual reproductive health and rights, especially for young people. And it was shocking that even the ministries of finance doesn't really know what portion goes to sexual reproductive health and rights. They just bracket everything under health. So is it time for us to really interrogate some of those systems, especially structural, that have been there for quite a long time, that doesn't allow us to have access to the services that we need, especially us as young people? I think at this time, in this space, we need to have real conversations. Those unsaid things, dreadful and hard conversation that we need. We need to make sure that our movement is that of no fear, of discrimination, criminalization, and allyship. We need to think differently. And I always love my friend who talks about doing development differently to me, who will talk about it later on, who always say, doing development differently requires learning what is not working, what can we improve, and calling what is bullshit exactly what it is. I encourage all of us to engage in these discussions over the next 3 days. Let's ask critical questions. What exactly are we not doing? What else can we do better? How can we cross-learn and exchange from each other, which is critical? And what is the roadmap that we want to move forward with? I encourage you, I know this is going to be controversial, take away your phones, put them away, close your laptops, because this is the most critical platform where we are for the next 3 days. And as soon as we realize our privilege being in the room and representing the rest of our communities and coming up with such a movement that when we go and implement, it will make an impact at the end of the day. The cost of inaction is big. We need to take action now. Thank you very much.
Thank you very much, Maximina, for that discussion. So may I please invite the Deputy Ambassador, Anne, sorry, I'm going to butcher your name, to give their remarks.
Thank you. So Good morning. My name is Geir Arne Schei. I honestly don't think my parents in Norway thought I would go abroad at all. But I must say that I'm truly honored to be here today. Not only to be here and listening to the energy and everything in the room here, but Norway is also pleased to support this symposium. I think we've been working with you for many, many years. And I think this is also an important opportunity to reflect a little bit on progress made so far, address challenges, and renew commitment to advancing sexual and reproductive health and rights across the African continent. And I understand that you have different things that you want to achieve with this symposium. So at front, I'd like to just start to reaffirm Norway's steadfast commitment to gender equality and SRHR. Our policy is anchored in the belief that every individual, regardless of gender, age, or background, has the right to make informed decisions about their sexual and reproductive health. And I think this is important, that this is not just a matter of individual rights, but I think it's a cornerstone of sustainable development and social justice. In the Scandinavian countries, this is a very important topic. I come from a country where you I've been brought up by my mother to play with dolls and not only try to be a man. So this is I think it's very important, and what you said also about the anti-gender movement is something that we have to take seriously. And I would just want to make sure that you have our commitment on this issue. I must say also the other thing, the other focus that you have on youth is also extremely important. And I guess there's no point of pointing out that the timing for that is interesting in a place like Kenya, but also Nigeria and other places in Africa. It's important to, it's not only important that you have the participation of young people. It's not only a desirable outcome, but it's an essential component of effective and sustainable policies and programs. Young people are not only the leaders of tomorrow, but also key stakeholders in shaping our approaches to sexual and reproductive health and rights today. And I think the momentum that you now have is something that I'm sure that you can build on. Our commitment is rooted in the understanding that young people bring unique perspectives and innovative ideas that are crucial for development of relevant and impactful policies. We believe that meaningful youth involvement ensures that our SRHR initiatives are responsive to the needs and aspirations of the next generation. And I guess the next generation is basically most of you people here. I also like to highlight a few of Norway's priorities in this field. One thing is that initiatives that ensure access to comprehensive sexual and reproductive health services. I think services are very important. It's including family planning, maternal health care, and safe abortion services. We are committed to reducing maternal mortality and ensuring that every woman has access to the care that she needs. Education programs that provide young people with accurate and age-appropriate information about sexual and reproductive health. Education is a powerful tool for prevention and empowerment, equipping individuals with the knowledge and resources to make informed decisions. Our approach to gender equality encompasses efforts to combat gender-based violence. It also promotes women's participation in decision-making and challenge harmful social norms. So I guess we're not really on that side of the anti-gender movement. We believe that true gender equality requires addressing the systemic barriers that sustain discrimination and inequality. We also recognize that achieving these goals requires collaboration across sectors and with diverse stakeholders. That's including governments, civil society, and the private sector. Norway is committed to working with our partners to strengthen health systems, advocate for policy change, and support community-led initiatives. In conclusion, Norway remains dedicated to advancing sexual and reproductive health and rights and gender equality. We are truly committed to supporting initiatives that make tangible differences in the lives of individuals and communities across Africa. Let us continue to work together with renewed determination and a shared vision for a future where everyone can enjoy their rights and live with dignity and respect. And I must say that I heard about the plans that you have, and I think you will have a very fruitful and interesting symposium. We will try to follow a little bit of that, but I wish you best of luck, and thank you so much.
Thank you very much. We were supposed to have the regional director for UN Women, Oda Ado, but she's been called for an emergency to South Sudan. But I know that she's asked Jacqueline to give her remarks. Jacqueline?
Good morning, good morning. I feel so young being in this room. I always tell Tumi she's my young friend. And I tell her, she thinks I love her just for being her, but I love her for being young because she keeps me young. I'm standing in for Hodan. Unfortunately, she was called yesterday to attend to emergencies in Sudan. We all know what is happening in our neighbor country. And the issues of inequalities, Jude, as you said, women and girls are more affected by those issues. So she had to be there, but she really sends all her blessings and regards and says that she knows that where there are young people, great things happen. So without further ado, Program Director Jude, and here in our midst we have the representatives of AU and the representatives of SADC, the Regional Director for UNAIDS in absentia, our multiple donor organizations, friends, and representatives of the UN family. I know UNAIDS is here in numbers, but I know UN Women also is not that little, right? And the representatives of civil society, young people, ladies and gentlemen. So what we are here to do today is actually very crucial because we were just joking, Jude, when we were talking, Jackie and I, when you mentioned SRHR, gender inequalities, and HIV, we said, finally, we waited for 20 years, but finally this is together in one room. And I think this is so momentous because we can't afford, as you know, to lag any longer. We are told that for HIV, same as gender inequalities, we have 5 years to end both. Who knows that's a crazy, crazy task to accomplish. We are told that by 2030, it will be planet 50-50. And then by 2030, we would have ended HIV as a public health threat everywhere, but on our continent. But we also know that as a continent, we still have a very sizable epidemic. Huge. When you look at the numbers, actually, sometimes I look at it and I said, maybe we need some very clinics to rethink these timelines. We also know that we still have the epicenter of the epidemic on this continent of ours, right? And we know that we have pernicious inequalities, especially gender inequalities, which will make both tasks completely difficult. But I know that there are many specialists on SRHR in the room. This speech of Hodan is focused more on the inequalities and the structural drivers based on those inequalities, which will make this task very, very difficult. It's not going to be a walk in the park. It is timely also to think about these things as we are actually on the eve of Beijing Plus 30, which is next year. 30 years ago, many brave women took over the world and said, enough is enough, we need a change. But when you look at what is still remaining to do, it's a lot. But we know that it is not impossible. In UN Women, we are pleased to say that we partner with most of you here in this room to actually do what is needed to be done, address the structural drivers of inequalities, which in turn become the structural drivers of vulnerability to lack of SRHR, to HIV, and to gender-based violence, which is actually one of the most pernicious forms of gender inequalities. But we also remember that at the heart of gender inequality, there is still issues of sexism, male dominance, harmful norms. So we need to also be cognizant of those and start discussing about those, not only on the outside, but on the inside. There is still a lot to be done, and prioritizing those issues that have not been prioritized, such as breaking the structural drivers that are driving this vulnerability, needs to be said. We can't afford to do business as usual, because business as usual has, yes, managed to help us reach many 95 in many countries, but has still not allowed us to reduce vulnerability. For example, for the young women, adolescent girls and young women. We still have rising infection rates in some cases. How do we continue doing business as usual? There is an issue that we are seeing almost across Africa, where because of economic standing or economic issues and ensuring a power imbalance between partners, young women are more and more turning into transactional sex, which is not actually called transactional sex. In places like in South Africa, they call it blessers, right? In other places, they call it sugar daddies. It's not recognized as transactional sex, and yet it renders young women very vulnerable. How do we tackle that? Because we've seen that once you actually address the economic vulnerability of those young women, then those tendencies are stopped. I think the hour is not for us to actually do semantics and talk about big rhetorics, but really come down to the crux of the matter. The young women, when you say these are risky behaviors, they say, okay, or I'll stop, but how do I feed at home? We need to find those solutions. I know that it's been very unpopular, but now people are starting to realize that if we are saying that we are funding SRHR, we are funding HIV, we are funding gender equality work, and we don't address economic disparities, we are not doing anything. The vulnerabilities will remain there. There are initiatives, for example, of addressing harmful norms. And here I always correct people because we tend to think that harmful norms means traditional norms. It's not true. Our institutions have harmful norms. Society has created harmful norms. Young people, this one I'm always fighting in my house. This is sometimes it's a great tool, but sometimes it creates so many harmful norms. There are many of the young women who are engaging in risky behavior because they can't feed, but there are many also who are engaging in those same risky behaviors because of the latest hair or the latest whatever, which they have seen here, which, by the way, is very fake. Those people put those photos and they change them. I'm sorry, now I'm back to being my 50-something self, you know? But those are harmful norms. How are we transforming those? In the discussions in the SRHR, how are we transforming those? There are initiatives we started at UN Women that are about community dialogues, community conversations, that are actually critical conversations for things to change. And we are seeing great results. On Thursday, for Women's Month in South Africa, I was in an informal settlement in Mamelodi where they were opening another branch. Very young women keen to actually transform their ways. And I'm very pleased about those. So those are the hard things we need to put in our planning. I'm not going to bore you, but I want to say that the hour is for us to actually not do business as usual. We need to talk about the critical issues that are prevailing in our societies. Thank you very much.
At this point, I feel that we should go home, but of course, it's unfortunately day one, so please enjoy. And may I please invite Reverend Bafana Kumalo, Executive Director to Sonke Gender Justice, for his opening remarks.
Thank you, Jude. It's a daunting task to speak after such eloquent speakers. You will realize that I'm no longer that young, but young still I am. In South Africa, we have two categories. We have the youth, and then we have e-youth and Dala. Now, e-youth and Dala, they are talking about people like me. Thank you very much, Program Director. All protocol observed. I do think that before I give my remarks, I would like to ask that we just take a moment and think about the many young people whose lives are vulnerable even as we speak, just for lack of access to SRHR services. Let us think of women and young girls in what was supposed to be the most developed country, the USA, who are being made vulnerable by a group of men who simply sit in the room and make a decision about women's bodies without taking into account the consequences. Let us think of the young women in Goma who, even as they wish to have access to commodities, are not able to because of the war in that environment. Think of young women in Ukraine who are placed in a situation not of their making. I can say with my last bottom dollar that women were very far from those who were concocting the war between Ukraine and Russia. But women are at the center of that war, and young girls are exposed. Let us think of young girls in Sudan and many countries that are facing conflict, both in our country and in our world. But I think we must also take courage that the Gen Z is an innovative group of young people. This is a group that refuses to say no. This is a group that says it is possible. It is a group that says another world is possible. And a special shout to the Gen Z of this very country who stood up and said to their leaders, health products for girls and women should be zero rated. A formidable courage to stand up to those in power, to say, now you no longer represent us. Let us take our hats off to the many young people in many of our institutions of higher learning, starting in the US and which spread across, who said genocide will never be accepted. It is not correct that women and girls and young people should be bombed simply because you have a conflict with whoever. And as we all know, where there is conflict, access to services and commodities becomes a huge problem. So I thought I must bring this to the room because we may be tempted to talk about these issues as if the world is normal. The world is not normal. There are many abnormalities, and we need to face up to them. And as I say, I salute the Gen Z because they are calling all of us to account so that we take responsibility for our action. We have no right to bequeath this world to you after we have messed it up. It is our responsibility that we correct these wrongs that we have created. the generation, I was told we're Generation X, must take responsibility. But as Generation Z, I want to encourage you to continue in your steadfastness. I stand before you today, my friends, with immense pride and profound sense of purpose as we convene for the Men Engage Africa Sexual Reproductive Health and Rights Learning and Exchange Symposium. This is the second installment, as colleagues have indicated. As the co-executive director at Sonke Gender Justice and a board member of the Men Engage Global, it is indeed an honor to welcome each and every one of you to this historic gathering. Our presence here, representing diverse backgrounds, organizations, and perspectives, is a testament to our shared commitment to advancing sexual and reproductive health in the world, together with the firm belief that SRHR is not just a matter of healthcare, it is a matter of human rights, justice, and equality. At Sonke Gender Justice, and through our work with Men Engage Africa, we have always recognized that achieving SRHR for all is a complex, multifaceted endeavor. It necessitates the active engagement of men and boys, sexual diverse communities, through a gender transformative approach and a steadfast commitment to feminist principles. And that is very important. Our journey has been marked by collaboration, dialogues, and the unwavering belief that when we work together, we can create a world where SRHR is not a privilege, but a fundamental right accessible to everyone, regardless of their gender, sexual orientation, or culture, or religious background. I want to extend a special thank you to the Norwegian Development Cooperation Agency. Please, Deputy Ambassador, take our message back to thank the people of Norway for their steadfast commitment to this work, even at times when funding for this work has been precarious. Your support and collaboration have been instrumental in making this symposium a reality. As we move forward, I hope that this partnership will continue to flourish and that you will stand with us in subsequent editions of the symposium, and more importantly, in the rolling out of the implementation plans that seek to ensure that no one is left behind with regards to adequate access to SRHR services and commodities. As we embark on the discussions and exchanges that will define this symposium, let us remember that our commitment extends beyond these conference walls. It extends to the communities we serve, especially the youth, the policies we influence, and the numerous lives we touch. This symposium is a platform for us to share knowledge, experiences, innovations. It is a space where we challenge norms, bridge divides, and forge alliances. It is not a moment where we collectively reaffirm our dedication to SRHR, but rather walk the talk. In the spirit of collaboration, let us actively engage with one another, learn from each other, and build networks that will extend far beyond this symposium. Let us harness the power of collective action, knowing that together we are an unstoppable force for change. As we delve into the rich landscape of discussions, workshops, and panels, let us keep in mind the words of feminist scholar Audre Lorde, who said, "I am not free while any woman is unfree, even when her shackles are very different from my own." Our work is interconnected, our struggles intertwined, and our goals shared. Thank you for being part of this symposium, for your dedication to SRHR, and for your unwavering commitment to a world where all individuals, regardless of their gender, sexual orientation, can realize their sexual and reproductive health and rights. I wish you a fruitful and meaningful and robust conversation as we compare notes, share experiences, and recommend innovative ideas to take this important work to the next level. A special thanks also to our partners in civil society. I thought I will just raise here a special thanks to SAFAIDS, one of the partners we work with closely, Girls Not Brides, Frontline AIDS, and many others, as the list is endless. Thank you very much. This process would not have reached here without your indelible support. Colleagues, welcome to the Men Engage Africa SRH Learning and Exchange Symposium. Together we will build a future where SRHR is a reality for all in our region. As I conclude, I always like to remind us that we have an advantage in our region. We have the youth dividend, which is apparent in all our countries. I remind our leaders that dividend is meaningless if we do not invest in our young people. We live in a world where our young people have to leave our shores in order to exercise their skills and talents and contribute to those that already are empowered in the North. It is important that we begin to shift the goals around, because we need to ensure that we create an alternative world where young people feel free at their own home, that they can exercise their talents right here and develop this continent. If we are to rise as this silent giant of a continent, investment in young people is the first step for us to turn the corner. As an African cosmology teaches me that our culture is embedded in the philosophy of Ubuntu. Ubuntu, a very powerful concept which is sometimes misused these days. But Ubuntu simply, in its etymology, is a word that does not denote, because by your achievement, I also am ingrained in that achievement. Another world is possible. Thank you.
Thank you so much, Reverend. Just adding my voice to say to all of the partners who have come to this symposium and who have organized the different breakout rooms and sessions, we thank you. You're deeply appreciated. And this is for you. Thank you very much. And just to remind ourselves that we take safeguarding very seriously. We've been told that the internet is not working. Colleagues, we apologize for that. While we get it sorted, and can I please invite Runia to please come to this front and introduce.
Thank you very much, Jude. Good morning, Karibu. Welcome, everyone. We're very excited to have you in the room. And as Jude has already indicated, I will be facilitating the power session. For this power session, we want to talk about policy frameworks and the gaps analysis. Policy frameworks provide us with a frame within which to work. As such, it is critical to critically look at these frames, to speak truth about what is missing, what has been left behind, what is it that we did not think about in a world of retrogression on the gains for human rights. Allow me to welcome Jacqueline again to give a keynote on policy frameworks and gaps analysis. Jacqueline is the Regional Policy Advisor at UN Women. Welcome, Jacqueline.
Thank you. I hope you're not yet tired of seeing this face. Okay, so I was told to focus on one key framework that has both all three, SRHR, gender inequalities, and HIV in one. And we've selected, and you'll hear a little more in depth from the panel later on the UN CSW Resolution 60/2. And as you know, CSW stands for Commission on the Status of Women. And one can't actually believe that already in 2016, they were very much ahead of their time. And many activists, feminists, member states, and here we need to really specially thank SADC that championed this resolution, which looked at addressing all structural drivers of vulnerability to gender inequalities and HIV and SRHR. So it was adopted in 2016, and it was because of the many underlying drivers of inequalities that they were observing and how they were impacting on HIV, and how without addressing them, then they won't be able to address HIV. So it looked at addressing HIV in its holistic view. So the resolution not only was adopted in 2016, it was also every 2 years it's recommitted. And this is the one resolution. As you know, those who have been in those negotiations, Reverend and the others, you know how tough they can be. Normally, there isn't any resolution that passes without fights, etc. But this is the one resolution that always passes with consensus. Meaning what? Meaning that the world knows that these are actually crucial issues. And this was done because of the things that are actually still relevant right now. We still have pernicious inequalities. We still have infringement on human rights, which are actually now escalating. We still have pervasive forms of inequalities and gender inequalities. We still have economic disparities, as I said. We still have discriminatory policies and social dynamics. And we have historically rooted structural factors. In my young age of activism, we used to actually bring to the fore, still brought to the fore issues of colonialism and slavery, and see the impact it still has actually on our societies and how our societies are functioning. So the rationale, all this, I have a presentation we can share, so I'm not gonna go through this. But this is also anchored by the 2021 Political Declaration to End AIDS, which actually called us to have an urgent and transformative action to end social, economic, racial, and gender inequalities, which are restrictive and discriminatory laws and policies if we are to end HIV and achieve SRHR. I think you all know that in our region, we still have adolescent girls and young women 4 times more infected than their peer men. So it shows that we can't talk about ending AIDS if we don't take care of those. Now, the resolution 60/2 anchors in 3 broad areas seeking to achieve, to address the harmful economic dependency, harmful social cultural norms, power imbalance, and lack of respect to human rights. It has a block on the structural drivers addressing, it says, promote equal economic opportunities and decent work for women, ensure the full engagement of men and boys, promote SRHR, promote access and retention and completion of education by girls, enact and intensify implementation of laws, policies, and strategies to eliminate GBV, and scale up scientifically accurate, age-appropriate, comprehensive sexuality education. Also has a block on biomedical provisions, promoting, I mean, it's all the biomedical things that we know of, but it also looks at the enabling environment, increasing political commitment and domestic financing to achieve gender inequality. This was in 2016, it's almost 10 years now, and we're still almost at where we were. Address special vulnerabilities of women with disabilities and other women excluded, especially in humanitarian context. Looks at available comprehensive data disaggregated by age, sex, and other characteristics we still don't have. Reduce barriers to women and girls' participation in the HIV prevention care, especially in the issues of national planning and budgeting. We still don't have a women voice there. Redistribute and value women's unpaid care and domestic work. This one, it's even almost a taboo. Now, when we look at the resolution, it's a beautiful piece of a framework. But when we look at its implementation, we actually, SADC, I think, is the only region that even went a step further and developed an implementation framework. But even with that implementation framework, we track progress, so much has not been done. Can please the Gen Z in this room push voices to get this resolution implemented? If we push our government to do that, you'll see that we are addressing those structural drivers that are keeping us closed. So I will leave it at here, but it has motivated SADC to adopt 3 gender inequalities related indicators in the HIV strategic plan. So we're getting somewhere. We just now need to track progress. I won't keep you. I will send this presentation for all of you.
Thank you very much, Jacqueline. I'd like to welcome to the front the power panel. Allow me to welcome Lillian Jerry Mbuti. Lillian is the focal point for Athena, Kenya. Allow me also to welcome Dr. Jean Bosco Butera. Dr. Butera is currently the chairperson for the Center of Inclusive and Sustainable Development in Rwanda. Allow me to welcome Irene Ogeta. Irene is the program officer at Athena. Allow me also to welcome Itumeleng Komanyane, the lead program at Frontline AIDS. Good morning, esteemed panelists. Irene, you had a request? Take up a mic and...
My name is Irene Ogeta from Athena Network. I'm so privileged to be one of the representatives of a feminist organization, especially because Jude did mention that for a very long time, feminists haven't been involved in this symposium. So I have a very small request. So you're coming to Kenya. We are convening here during a very crucial moment for us here in Kenya. We've had lives lost, especially lives belonging to the Generation Z, who have been fighting for our liberation. And so my request is, if we could all stand and just have a moment of silence to honor the lost lives of the Gen Z of this country, and the most recent ones, Bangladesh. We also know all what happened there. So just 3 seconds to just observe this moment. Thank you. Thank you. We may sit.
Thank you very much for that, Irene. So we'd like to begin our discussion, of course, taking off from where Jacqueline left off. We would like to focus on assessing the progress made in the implementation of the CSW Resolution 60/2. And I would like to ask Lillian, may you speak specifically to assess the progress that we've made as Africa on scaling up age-appropriate comprehensive sexuality education?
Thank you so much. Us here. Um, as a Gen Z, as also as an adolescent girl, young woman, in my own diversity across Africa, if I could speak on how much progress we've made on CSE, even in Kenya, and now we are looking at it regionally. We've seen a UNESCO report that has reported on only 13% implementation across schools. And most of them are actually private schools. Vis-a-vis, quote unquote, in Kenya, we call them the international or the academies in Kenya. We still have a very long way when it comes to integrating this, even in our curriculum. There's a point in time about 4 years ago where the Ministry of Education had actually tried implementing it in one of the textbooks in Kenya. And parents, community leaders, church leaders, they're the ones who actually came forward with the idea that, or rather with the ideology that we are trying to, quote unquote, prepare our kids, our children, to become adults at a very young age. They weren't looking on the other side that if they don't have access to this information, education, awareness, they wouldn't be in a position to feel empowered to make informed choices and decisions about their own bodies, their own health and well-being in general. So the root cause of us not having made so much progress as we are envisioning currently, or what we are pushing for, especially as young women at this grassroots level, nationally, regionally, even before we look at globally, we need to be in a position whereby as much as we are thinking globally and we want to act local at the moment, we need to empower community leaders, the parents as well, and also the church leaders. That is where the problem is.
Thank you very much for that, Lillian. I think that's why we have the community leaders, the religious leaders in the space so that those conversations can be had. Irene, could you also maybe speak a little bit about what would be your assessment of our implementation across Africa in terms of elimination of gender-based violence?
Oh, thank you very much. So I will start by stating that the global issue of violence against women and girls it still continues. And sadly, it's not only affecting these individuals, but it's affecting everybody around them, the community, the country, and it translates to the region, and again, it goes all the way to globally. So according to the existing data, we have seen at least 3 women have to experience violence, either physical or sexual violence, at some point in their lives. This is not something to really enjoy having a conversation on, or rather even speak. And worst of it is that over the last 10 years, we are not really making a very good progress. We still see femicide cases on the rise and sexual assault cases on the rise. Kenya has been in the limelight for femicide cases. We've been on the street for a better part of the last few months. And so for as long as there is progress, and we have policies and laws, like in Kenya, we have the Sexual Offense Act of 2006, which is supposed to be acting as a legal framework to combat sexual violence, but we still see a bit of challenges when it comes to enacting it, and mostly it revolves around resources. Our governments do not really allocate enough resources to be able to cater for this. So we still have the regions that are considered hard to reach regions where these policies are there, the law is there, but in terms of legal services, it's still, at least there is it's still lagging behind. And also when you look at issues of shelter, survivors of GBV, sometimes you have to take them away from the environment, but where do you take them if there is no resources to be able to support to allocating some of these shelters? And so for as much as we're making progress, we also have to acknowledge that these challenges, but not only about resources, but we also have traditional norms, you know, which are standing as a block. So we also have, Jude did mention about anti-right movements. And so as a feminist speaking here, that's really a big challenge for us, because for as long as you're trying to move forward, there is still a lot of this. So in order for us to increase effectiveness, we must continue enhancing a few things, and that is one, multi-sectorial approach. So we need our governments, international institutions, UN agencies, to CSOs, NGOs, to collectively work together. So we have to acknowledge that it's not a time for us to continue working in silos. It doesn't matter whether you're in gender equality or SRHR responsive or HIV, but the thing is we need to work together because the complex challenges relating to GBV, health, education, and all that, it takes a multi-sectorial approach. And so if we incorporate all this, then we can definitely achieve it. And then another thing is we must have programs centering within the community. So we have to make relevant, useful of the local community in order for them to own every initiative, be it implementation or rather enacting of policies. It has to start from the community. And once the community is at the center, then it means that this community can also be used as a strategy to remove obstacles based on culture and issues like that. And then last but not least is we have to allocate resources to deal with GBV issues. So it is very critical for us to guarantee that GBV programs are going to be resourced and they're going to be resourced in order for sustainability as well as advancing this. So I will say that yes, we're making progress, but still we have to push ourselves to commit further and yeah, in order to achieve much more, because I believe that we can achieve more than we have already achieved as it now.
Thank you very much. We believe that we can do it, but we need to start thinking more and more about the resources, because if we don't allocate money, then most likely we can't do it. Dr. Butera, would you please speak a little bit about what is your assessment of the progress that we've made as Africa in terms of ensuring gender equality?
Thank you for this opportunity, first of all, and let me thank the organizers for inviting me. When you look at resolution 60/2, in action point number 2, it calls upon member states to intensify efforts to achieve gender equality and empowerment of women. And I think it's important to pay attention to that part because it calls on member states. And I think Jacqueline mentioned this, if I may, you may allow me to call you Jacqueline. When you started, you know, we have this global instrument, but we know and we have seen that action, if it's not taken at the level of government, you don't see changes. So if you go in Africa and you look at the situation in Africa, we know that we have done progress, but mostly in adopting protocols and directives, yet report after report, and we said it here, we see that the level of progress that we have does not allow us really to change the lives of women and girls. That's the reality. We can applaud ourselves for the processes, the instrument, but on the ground we still have challenges. And we have institutions on the continent that have done research that have shown that gender parity still stands at a level, again, that is not acceptable. If you look at McKinsey Institute, they say it's 0.58, where one would be really achieving a parity. So we're still low. So, and when you look at the Afrobarometer and you ask women, what are the key areas where we still have challenges? They are mostly four. The gender-based violence, as my colleague has said, a limited participation in decision-making spheres, access to education, and socioeconomic opportunities. So those are the key areas. And we know that all in those four areas, we are still short of good achievement. So I would say that really, in terms of equality, we have a long way to go. We have countries that have done in some areas, but when you take all the four areas, key areas that are identified by women, I do think that most of our countries, if not all our countries, still short of targets and delivery. So that's really what I think that we need to look. And even when we talk about progress, we still have practices that are really impede the advancement of rights of women. And I just give an example. If you look at Africa, we have 15 out of the 20 countries that have the highest rates of child marriage. And we know very well that when you have child marriage, it's a barrier to girls' education and socioeconomic prospect. Last year, when we were looking at the Maputo Plus 20, we said that there is a need to do an accelerated implementation. So I think really where we stand, we are far, and we need to gather again and strengthen our action at the level of our government. Our government are the ones who are the first and foremost implementers. So we need to do an accelerated action. Thank you.
Thank you very much, Dr. Butera. So we're doing well in terms of processes, but the actual achievements on the ground are missing, and we need to do more. This is where we come in, especially the Gen Zs, to push the agenda, to say we need to see the actual realization and the actual movement of the indicators for gender equality. Tumi, could you please speak to us a little bit about your assessment of our progress in terms of promotion of universal health coverage?
Hear me? Perfect. Before I start, I'd like to just thank Men Engage for bringing us together. This is a critical conversation happening at a time when the world is facing so much. And when it comes to issues of access to universal health care, it will be remiss, not to talk about, let me start here. We all know that we're not achieving it. And we're not achieving it for the same reasons why so many other things are not going right in the world currently. As I was starting, I was talking about the world facing polycrises. So we're currently dealing with issues of war, civil strife. We're dealing with issues of poverty, and I'd like to just focus a little bit on Africa. Issues of migration and immigration. And so before I even want to start talking about universal health care, it is critical that we recognize that for as long as the world is unstable, funding for healthcare will remain at the bottom. I remember when I studied economics and we used to talk about the cake, the budget cake. And often when we thought about the cake from an economical term, healthcare was never the one getting the biggest chunk. It's always trade, it's always when I started talking about war, my mic went off. I promise I'm not about to start another uprising. But it is important to talk about the ways in which countries prioritize funding. And often healthcare, and particularly universal healthcare, which should ideally be achieved through primary healthcare, is seldom the one that gets the biggest piece of the cake. And so I start with this very sober reminder that for as long as decisions around where the budgets go are not being informed from a health perspective, we're not centering youth responses, and particularly any response that comes from the society in that decision making, we will not achieve some of these ideals that we hope to get. So when I got involved with the resolution 60/2 years ago, I firstly was not even aware of its existence until I started working or going back into the HIV field. And one of the things that really, for me, was very important, particularly looking at the linkages to universal health care, was again how often when we think about HIV, we tend to focus on HIV. We see people in terms of their status. Are you HIV positive? Are you negative? And if you're positive, are you on treatment? And that's where we usually leave it. And a lot of our programs tend to celebrate that, yes, we're achieving viral load suppression. But increasingly with the resolution, it forced us to also look at people holistically and particularly adolescent girls and young women, because they're not a sum total of their HIV status. So when young people, for example, go to the clinic, it's not just about them getting ARVs. It's also about, are they getting access to mental health and PSS? Are we able to screen for... That's my team. Are we able to also screen for non-communicable diseases? Are we able to see proper referral linkages beyond HIV to SRH services, commodities, and promotion? Do we even know where these services are being delivered? And so when we think about UHC in 2024, this is what we know. Because of climate change, the link between SRHR and HIV is not being met. Because many people, and particularly how it affects women, when women are still stranded on the land, trying to till the land, trying to grow plants, many of them are limited to even access SRH. In my previous life, I was formerly with Men Engaged. We used to play a video. It was, how did Mrs. X die? How did Mrs. X die is a video that's freely available on YouTube. And it shows you the plight, and particularly of women in developing countries when it comes to access issues. And it shows you a journey of a typical woman. If you're thinking of poor Africa, if you're thinking of war-torn Africa, and thinking about the barriers that women and the girl child continue to face. Even from a simple thing as men continue to make decisions on women's health, men who continue to make decisions on when a woman can and cannot give birth, and a woman having to wait for a man to come and take them on a wheelbarrow to gain access to a clinic that's miles or kilometers and kilometers away. So in a sum total, there needs to be decision making around how do we resource health. I think one of Mexi this morning spoke about financing for health. And underscoring the access to universal health care is holding governments accountable. And as we stood earlier in a moment of silence and just thinking about the courage that it takes to hold governments accountable, it comes with bloodshed. And I don't know how many of us are still willing to spill blood in order to gain access to the basic fundamentals around human rights and healthcare. It comes to thinking about how health facilities themselves are designed. When we think UHC, we're thinking about a health space. Firstly, do we have clinics in our communities? And are the communities resourced, the clinics resourced? Do we have staff? If the clinic has staff, do we have medication? And we all know what happened during COVID-19, where everything just literally turned on its head. As we're thinking about UHC, we're also thinking about migrant populations. I live in South Africa, and we know currently what the status of migration is in that region. So as we're thinking of people that are displaced and having to leave their homes and go to new countries, are there health facilities that are catering for those migrant populations? And are they getting access to universal health coverage? I think you can all answer that question. We're not anywhere close to that. And then finally, I wanted to talk about, again, going back to the friendly service delivery, because our focus here is also on young women and adolescent girls. A lot of the times when we think about services, right, youth, universal healthcare, primary healthcare, we often forget that the service infrastructure in itself is not open to the different needs. Someone spoke about disaggregation, but disaggregation goes beyond gender and age. It also goes to, are we inclusive in the design of health spaces to ensure UHC? And the answer is no. We're still grappling with issues of the health space being fairly feminized or womenized. And so even if you're thinking about access of healthcare by men and young boys, that is another bump in the road. So I could go on and on, Runya, about where we are when it comes to UHC, but the bottom line is we are not meeting the aspirations, whether it's for the SDGs aligned to UHC, whether it's for primary health care. Our governments are still failing us because a lot of the times when it comes to where budgeting is concerned, it's seldom where health is covered. And lastly, when we're thinking about the poly crisis that is currently facing the world, it is forever making sure that health care stays at the bottom of that priority list.
Thank you very much, Tumi. I like that this is a very sobering moment because all of us are talking about the different indicators, but we have a consensus that we're not doing well. And we're not doing well because of the structural issues and also largely because of financing. And this is where we come in to say we need to hold our governments accountable to ensure that there is financing for health because it is one of those underpinning critical human rights. I think you've already touched a little bit on it, all of you, but I would just like to give an opportunity to Lillian and to me to explore the barriers and some of the challenges that are hindering the realization of the rights of the girl child in the context of HIV prevention and treatment. You've touched a bit on it, but maybe just to zone in on it, the barriers and challenges that are hindering the full realization.
Great. So I ran a cohort of about 51 girls across the country. At Athena, it's called the What Girl Wants program. And out of the 51 girls, 31 of them represent the 31 counties out of the 47 counties in Kenya. That goes to show that out of the 47, there is about 16, if I'm not wrong, that aren't included in this conversation. And this has been going on over the years. So even the reach, the information reach in terms of them having access to the awareness bit of it, to the education bit of it, is still a very great challenge. And this now translates to the prevalence that we are seeing across the country, especially two counties. That is Kisumu, Homa Bay, and actually Siaya County. Now, other than just the digital advocacy bit of it, them having access to information and so on, we still have a really great challenge in terms of the inadequacy access to the healthcare. For example, I have a girl from Turkana and another one from Marsabit in my Kenyan cohort. And they have to walk miles and miles away up until they are able to access at least a clinic. And then when they get to these clinics again, be it them just checking their status, be it them just accessing any other general healthcare service, they're still getting a medical practitioner who gives them this awkward look on their faces and asking them, at your age, what are you doing exploring with men, you know? So even just curating a youth-friendly or rather a youth-centered healthcare is very vital and it's still very a great challenge. So we have the digital advocacy or even access to information bit of it. We have inadequate access to healthcare, and even we're still facing that awkwardness when we want to access all this information, or even when we're checking our status, when we're trying to access treatment, and so on. So we still need to work on that.
Thank you very much for bringing that up, Lillian. And I really like the point that you brought up to say accessibility. Where are these clinics? Are they closest to the communities? Because it's one thing to count clinics to say we've got 50, but if we've got 50 clinics where we have 80 villages, it means that we don't have 30 clinics. Yeah, thank you very much, Tumi, if you could.
Thanks, Runya. So one of the programs I've been interested in supporting is the Ready Plus program. And Ready Plus works across 7 countries in Africa. We reach over 45,000 young people with services. And the reason why I wanted to start off by talking about Ready Plus is that at the onset, Ready Plus is a program that really targets young people living with and affected by HIV. And we do it through a socio-ecological approach. Firstly, recognizing that young people, as who they are, have the agency to change the lives, not only of their lives, but the lives of other young people. So it's a peer model approach that centers on building capacity of young people as peer supporters to support other young people. We then recognize that beyond young people achieving viral load suppression and being healthy, it was important that we also saw young people through an intersectionality lens. And so the program incorporates gender equality, it incorporates transformation of how we see and do things. It also incorporates recognizing the social and structural barriers around gender and gender-based violence and gender equality as an intersection with HIV response. And then, as always, wherever you're working with communities and particularly young people, it's imperative that you build sustainable environments to support them. And so a second layer of the Ready Plus program recognizes community resilience and the role of parents and caregivers in sustaining the health gains of young people that are on treatment or that are seeking SRH and other services. And so a part of the Ready Plus program is then building capacity of caregivers. One of the things that we constantly find when it comes to barriers is that even where young people are empowered and have agency to get treatment, for example, it's often when they get back home that there are challenges. One is monetary investment in creating structures, but it's also building capacity of health providers to provide adequate services and to tailor-make those services for the populations that need the services. And so a layer of Ready Plus is then building capacity of health workers and the health infrastructure to provide youth-friendly service delivery, but also, most importantly, to create what we call quality improvement plans. Another barrier that we were finding, for example, was that a lot of the times we speak about, we talk about young people accessing health, but seldom do we put the power of monitoring and evaluating the level of service delivery. And so through Ready, we have what we call the Ready to Care scorecard. And it's essentially a scorecard that measures the efficacy, of healthcare that the young people get in clinics. And through that scorecard, we're able to improve the quality improvement plans of the health or the ministries of health or the local health departments in order to support overall quality improvement services. And then, as always, and then I think this is also critical to something Jackie mentioned earlier, is that at the core of 60-2, at the core of universal health coverage, at the core of any act, policy, or framework to do with health, is putting decision-making powers within the people that need it the most. And so a very critical element of Ready Plus is building capacity of young people as change agents, as youth advocates, and ensuring that they sit in the spaces where they can speak for themselves. And so for us, the principle of leaving no one behind is very crucial. And then the last one that I wanted to touch on, again linked to poverty eradication, again linked to issues of a lot of our young people coming from low resource settings, is that of income generation. So linking young people to income generation opportunities to reduce their reliance on the sugar daddy syndrome, on the blessers, and so forth, but also recognizing that a lot of young people, once equipped, even with a stipend, it's enabled them to make such different decisions for themselves and for their futures, as well as for them as parents. And so I speak about Ready Plus because in us trying to respond to the different barriers that you asked me to speak to, Runya, it's one of those models that are not only able for, are not easily adaptable, but it's also, when we're thinking about models and programs, for example, what Lillian mentioned, is to what extent are governments willing to take up and scale up programs so that as funding goes down, because we can't always rely on funding, right? So when we're starting to think about the domestic resource mobilization conversation, how are we going to leave this room and make sure that governments take up and scale up models that have proven to be quite efficient?
Thank you very much, Tumi. I really like what you've just spoken about, the Ready Plus model, to say that we need to start thinking about people in terms of all the things that connect them with their outside world and pre-plan for those barriers that we know might exist and be very proactive in our program design so that we're not reactive as we are recognizing barriers as we go along. Dr. Butera, may you please just speak to us about the opportunities for strengthening policies and programs to better support SRHR in Africa?
Thank you again for this opportunity. I do believe that though it's about 21 years old, the Maputo Protocol still gives us I would say, the largest opportunity in Africa to address these issues. But I do think that we don't pay much attention to that protocol enough in our discussion and engagement. We see it there, but we don't take the time to go through and say we can use this section and or the other one to address issues. If you look at it, it addresses the different vulnerabilities that we have on the continent in terms of the right of women. You have women with disabilities, you have women who are in distress, you have young, but I don't think that we do have that time, that we pay that much attention to the protocol. Maybe we say it's an AU instrument, and it comes to the issue that we still keep discussing to say, maybe we have instrument. Well, I have to say I worked with the AU, so I will be coming to instrument of the AU. That's why. So maybe we see them as instrument that at that level, but people don't internalize them and really engage our member state. And I think civil society has the responsibility to engage. You go to different countries and you can have different platforms, some very active, engaging with member state, some not that much. Of course, the member state also need to create that atmosphere and the conditions. So I think the Maputo Protocol is the key one. The second opportunity, the second that we have, and which is very recent, is the initiative on positive masculinity. And it started in 2021, and I do believe that really this one is also another opportunity. And I want to quote when you look at, we had the last meeting in South Africa, and I remember Reverend Kumalo was there. I think he moderated one of the sessions. And I want to quote President Ramaphosa when he said, really, he summed this very clearly. We seek a world in which every African man, woman, and child can live in true freedom and equality with their rights respected, upheld, and advanced. We know that such a world is within our reach if we focus on the prevention of all forms of violence against women and girls. So this one, it was really talking about the positive masculinity is an opportunity to engage men. And I'm happy that today we are talking about men engage. Because all the issues we're discussing with the SRI, we have the sexual right, we have all this, but if we don't involve men and have them be part and parcel, then really we are missing an opportunity. So I think the initiative on positive masculinity is another opportunity for us to address the shortcomings. It's still at the beginning, but it's going towards also, it has initiated the idea on the convention on violence. But I think that's something we're going to discuss later, because we may also be looking at a convention and only looking at how do we address violence against women and girls, but time is up. But we're not looking at how do men engage, how are men part and parcel of that endeavor. Thank you.
Thank you very much. I like that you brought up the engagement of men in positive masculinities. We need to have conversations about power. What are the structures that drive these barriers, and how can we control for the barriers? So we don't have a lot of time left, but we would like to move on to have a conversation about the Summit of the Future, to just analyze the outcomes of the summit and its implications for integrating SRHR, gender equality, into the upcoming development agenda. I'll ask Tumi and Irene to speak briefly on that.
Thank you so much. I love the part briefly. I really hope we keep it as brief. So first, it's great for me to mention that the Summit of the Future has emphasized on the need for us to try and sort global issues innovatively and inclusively as possible, with the realization of intersectionality in all this. So we have to understand that diverse populations encounter diverse challenges, and our needs are not homogeneous, and this cuts across HIV, SRHR, and gender equality issues. And so looking at some of the outcomes, so the summit did outline the crucial need for us to guarantee, and when I say us, is the CSOs and all stakeholders involved around matters SRHR, to guarantee that everybody will have access to comprehensive sexual reproductive health services, which cuts across maternal health, contraception, even HIV testing. When you talk about policies that are restrictive and punitive laws in our countries that can't allow a 15, 16-year-old to work in a clinic and get services, but yet we recognize and acknowledge that they do have sex. So that's also very toxic. So our policies must also be very flexible to ensure that people can get services at their own time. But the most important bit of it is we must strengthen robust action to address gender-based violence. But the summit particularly did demand for the adoption of the laws that are going to be supporting gender equality in all spheres of the society. So be it at workforce, be it education, be it politics and leadership spaces, we have to acknowledge that. And in terms of looking at the implication on SRHR, one of the summit's main recommendations is to include SRHR in development plans. And we have to look at it holistically and address it holistically in policies and programs that are meant to ensure that services are available, they are equitable, they are efficient, but most importantly is they are affordable, because affordability is quite a thing. And also listening to Tumi and Lillian speak, that came out quite so much. So I see my time is up. But in terms of the most important thing is the next step. What does this really look like? National, international policies need to align with the commitments of the summit. So we need to ensure that development strategies are actually giving priority to SRHR and gender equality. But most importantly, we are putting the community at the center of all this. Because by incorporating gender equality and SRHR into development frameworks that have already been established by the Summit of the Future, we can move closer to a future that is more inclusive and equitable. And we can translate these very beautiful insights and commitments into practice and strategies that we can use to implement at the program level and also within our institutions and beyond.
Thank you so much. Tumi, we have 2 minutes.
I'm very good at timekeeping, so I'll leave my my long speech, but I'd like to end by perhaps making this a call for action, to say that aligned to the Summit of the Future and for the next 3 days, Jude, what I hope will come out of the SRHR Linking and Exchange Symposium will be clear pathways of how we intend to hold governments accountable, making sure that we leave no one behind, and that we safeguard future generations, which is critical to Summit of the Future. Secondly, it's around making sure that the conversations happening here make their way to UNGA, where Summit of the Future will be happening, and I hope, well, let me not say I hope, I implore that for all of us in the room who are able to support young people to attend UNGA, and to make sure that we have a parallel side event, Jude, at UNGA, to ensure that the conversations from Africa find their place at the Summit of the Future coming up. So to all of you who have the ability to fund and support young people to attend, I please ask that maybe on day 3 we get those commitments. And then another requirement was that we use data. A lot of the times when it comes to the work that we do, we often have a lot of very rich data that does not inform action. And then I think that's another thing that perhaps one of the outcomes of this symposium should be thinking about doing development differently. Mexi said, I like talking about that, but for me it's also about recognizing data from the region and making that data be critical for informing how work is funded, and particularly how the response to HIV and gender is invested in. And then finally, looking at enhancing cooperation. So again, looking at funders, development partners, and making sure that as we work towards Summit of the Future, there is a renewed sense of investment in the future of Africa. Thank you.
Thank you very much. We've gone 2 minutes over our allocated time. I know we had two more things to discuss. I'll ask that maybe you can avail your notes, and then we can share those to all the colleagues in the room. But thank you very much for taking the time. Over to you, Jude.
Thank you very much. That is supposed to be a power panel, so not so many questions. We hope that in the breakout rooms that we will separate to would have opportunities to have those conversations, but also at tea time. Colleagues, I know that we are running a little bit late, so I'm going to try to keep this short. Just to say that the Summit for the Future on Friday, we do have a session which we have scheduled in the afternoon, and the idea is to have those conversations in terms of what are the plans, and that's the call that Tumi is referring to. Please let's all convene in this room at 2 o'clock on Wednesday, so that I'm extending your stay by 2 days, cost free, right? So on Friday, let's all reconvene so that we can have that discussions and commitment. All right. So colleagues, as this panel was speaking, something that came to my mind was a conversation that Dr. Butoya was speaking to say, Africa does have policies that we seem to have, it seems not to be a priority to us. We will be commemorating the 20th anniversary of Maputo, or 21st anniversary, and it's not something that we refer to as often as possible. So what we did as Sonke Gender Justice and Management Africa was to look at the policy frameworks in Africa and how they've impacted sexual and reproductive health and rights. And so what we are launching today is that report. So can I please have, So we did a regional policy analysis of sexual and reproductive health and rights and frameworks in Africa. And the idea, we could not do all 54 countries in Africa, but we know that these countries work together. So we did the Francophone Africa, we did East Africa, we did Southern Africa. Now, we were particularly looking at the frameworks regionally and nationally. What we went further was to see how our courts have interpreted these regional frameworks and the lessons that we can learn from this court judgment. So this is the report. The slide is a little long. I'm just going to try to keep it short. And so I encourage you all. We only have the report available in digital version. We're going to share the digital version. I'm sure everyone in this room, you are the first people seeing this report, and I hope that you would go in and read through the report. All right, can I please have the next slide? Next. So the background, of course, we know these things. This is not something that I need to remind us. This is part of the reason why we're convening here. We know that Africa, of course, remains one of the worst regions affected by sexual and reproductive health and rights, ill health. We are accountable for high maternal deaths, unsafe abortion, teen and unintended pregnancies, HIV, and unmet need for contraception. This was worsened at the time of the COVID-19. And of course, there are other pandemics that are coming up, right? There are climate crises that we see emerging in different countries, and that is affecting access. There's also conflict, which seems to be picking steam in some countries, and that is also affecting access to sexual and reproductive health and rights. So all of this serve as a barrier, in addition to the restrictive policy frameworks that already exist. And so, can I have? We looked at these regional frameworks. It's the African Charter on Human and People's Rights, the Maputo Protocol, the Charter on the Rights and the Welfare of the Child, the Youth Charter, the protocol to the African Charter on Human and People's Rights, on the rights of older persons, and the most recent, which is the protocol to the African Charter on the rights of persons with disability. This is a very important conversation because most times we assume. And then we look at some of the binding instruments that have come out, the resolutions that the different AU institutions have come out with and what they speak to. So we have the resolution 275 on ending violence against women. We have 552 on the rights of intersex people, the general comments on the Maputo protocols, and the general comments on child marriage and FGM, which unfortunately is still very present in our continent. And then we look at also clarifications that have been provided by the different African Union institutions. So I'm not going to speak to each one of them, but they are all detailed in that report and how that impacts access to sexual and reproductive health and rights. And some of the policies that the AU have enacted that speaks to SRHR, this is the Agenda 2026, Maputo, the Abuja Declaration on Health, HIV and Tuberculosis, and their Abuja Declaration is particularly important to the conversation that Maximina spoke to on financing for health. 15% of our health should go of the state budget should go towards health. And if we analyze our state budget, we realize that in some countries, it's not even up to 1%. We invest so much in ensuring that we have arms, even when we are not at conflict. We don't invest as much in health. And so that Abuja Declaration is very important in terms of that conversations. And then, of course, the African Health Strategy and the recently Continental Framework on Education for Health and Wellbeing, which was launched last year. Now, we look at the sub-regional level, ECOWAS, and I'm not going to read what the ECOWAS has done, but it's there. And we can then move to the Southern African Development Community that is also doing some work in terms of ensuring that there's policy framework. And for the two countries in the Southern African community, we looked at South Africa and Malawi. We look at the law of South Africa and the court's judgment and how they have served to advance sexual and reproductive health and rights. So these are just some of them. In the report, you would have analysis on the issues that we discussed and how that has impacted access. And in Malawi, next slide, we also looked at the different the policy frameworks that exist in Malawi, but also the case law, what has come out in terms of court, how have the courts interpreted access to sexual and reproductive health and rights, because sometimes we know it's a right that we can only get from the courts. We can't get easily. So we looked at how the courts have interpreted that. And so can we move forward? And then we went to East Africa, and Kenya, of course, Kenya is the country that we used to go with, which is the Constitution, the Health Act, but also cases that have gone to court, and that has been won, or that we find to be progressive in terms of our work and in advancing sexual and reproductive health and rights. Uganda, too, we also looked at that, and of course we know that the issues that we face in Uganda, and of course the case law that has been won, the progress that has been made in terms of law. And for West Africa, we looked at Nigeria and Liberia. Unfortunately, not so much in terms of case law, but the constitution-wise and the other policy acts speak to that. For Francophone Africa, we spoke of the Democratic Republic of Congo and Cameroon, and we spoke of the law, and again, not so much case law that has come out from these countries. What was our recommendation after looking at these reports? We feel that the African Union and the different committees need to ensure that states report on the measures they've taken to comply with the norms and standards that exist at regional level. So this speaks to accountability at AU level, but also for us to the AU accountable. To provide concrete resolutions on SRHR, not to address the issues head on. To look at laws and reforms that ensures that the human rights institutions and instruments are integrated into the different countries. And of course, ensure adequate resource, allocation of resource to addressing SRHR issues. I see I have 5 minutes. And this is what speaks to us as civil society. But I like that there's also government in the room to say that civil society, we need to continuously provide technical support to our policymakers, even as we frame the language, as we look at the laws. We also need to provide that support to community-based organizations and groups in terms of SRHR. We need to build capacity of the human rights bodies and to ensure effective realization. And we need to ensure that national human rights institutions ensure that they monitor state compliance on the concluding observations. We need to engage with stakeholders to ensure law reforms on issues related to sexual and reproductive health and rights, and to ensure that states domesticate relevant human rights instruments and standards on sexual and reproductive health and rights. So I will tell you that this report is very interesting. I will encourage you to read, which we're going to share by close of day today. And I hope that you do go through and see how you can use it to improve on the work that you already do. Thank you so much. Merci beaucoup, Asante Sana, and all of the others. So we are closing this January. This is the last time today that we'll see each other in this room. The way we've structured our program is to ensure that we leave room for more conversations. And so we have asked colleagues, there are 4 breakout rooms, to go to these 4 breakout rooms after our tea to, that's where the conversations will be happening. Just to say that, sorry, one moment. Why I'm referring to the program, just to also add that for the cultural evening, in terms of announcement, for those colleagues that are based at Hill Park who could not come with a change of clothes, we have one bus, just one bus for 30 people. Please, if you can, it will take you to Hill Park and back for those who were not able to come with a change of clothes. And we would ask that you be back here at 18 hours so that we can finalize that. And so the cultural evening, we're asking colleagues to come in the best possible representation of your culture, right? I know some countries, some of my colleagues are joking to say, we are a colonized country, and so we don't have anything left. So you must find something left in your country to come with. And so this announcement is very important. There is a breakout room, Koitale 1. Koitale 1 no longer exists. So there are 3 breakout rooms on the floor, on the ground floor. The Koitale 1 is now the Bongoi ballroom, which is downstairs. So you take a lift 1 step down, you get to all of the breakout rooms. The colleagues who would be on the, so the colleagues who will be maintaining this room, and then everyone else will be downstairs. I hope that is clear enough. And on that note, enjoy your tea. Sorry, colleague, one last announcement. Somebody left their mobile phone in the watchroom. If you did leave it in the washroom, please ask Runia to collect your mobile phone. Thank you so much, and enjoy your day.